1. ST segment elevation on an ECG may indicate a myocardial infarction. True or false? Answer: true. Rationale: ST segment elevation on an ECG is a hallmark sign of ST elevation myocardial infarction, STEMI, indicating full-thickness cardiac muscle injury due to coronary artery occlusion, per AHA/ACC guidelines. 2. Myocardial infarction is caused by a blockage in the pulmonary artery. True or false? Answer: false. Rationale: MI results from occlusion of a coronary artery, not the pulmonary artery, leading to myocardial ischemia and necrosis, per cardiovascular pathophysiology. 3. Chest pain radiating to the left arm is a typical symptom of MI. True or false? Answer: true. Rationale: chest pain radiating to the left arm, jaw, or shoulder is a classic symptom of MI due to referred pain from cardiac ischemia, per AHA clinical manifestations. 4. Troponin levels rise within 3 to 6 hours of an MI and remain elevated for up to 14 days. True or false? Answer: true. Rationale: cardiac troponins, I or T, are highly specific biomarkers for MI, detectable within 3 to 6 hours and elevated for 7 to 14 days, per ACC diagnostic criteria. 5. Women are more likely to present with atypical MI symptoms than men. True or false? Answer: true. Rationale: women, especially older adults, often present with atypical MI symptoms like fatigue, nausea, or shortness of breath, per AHA gender-specific guidelines. 6. Nitroglycerin is contraindicated in patients with hypotension during an MI. True or false? Answer: true. Rationale: nitroglycerin causes vasodilation, which can worsen hypotension, systolic BP less than 90 millimeters of mercury, a contraindication in MI, per AHA emergency protocols. 7. Smoking is a modifiable risk factor for myocardial infarction. True or false? Answer: true. Rationale: smoking promotes atherosclerosis and thrombosis, increasing MI risk, and cessation is a key prevention strategy, per AHA risk factor guidelines. 8. A normal ECG rules out myocardial infarction. True or false? Answer: false. Rationale: a normal ECG does not rule out MI, as non-ST elevation MI, STEMI, or early STEMI may show normal or nonspecific findings, per ACC diagnostic standards. 9. The nurse should administer oxygen to all MI patients, regardless of oxygen saturation. True or false? Answer: false. Rationale: oxygen is indicated only for MI patients with hypoxemia, SpO2 less than 90%, as routine use may not benefit normoxic patients, per AHA 2020 guidelines. 10. Aspirin is given to MI patients to reduce platelet aggregation. True or false? Answer: true. Rationale: aspirin 162 to 325 milligrams chewed inhibits platelet aggregation, reducing thrombus formation in MI, a standard emergency intervention, per AHA protocols. 11. Myocardial infarction always results in permanent heart failure. True or false? Answer: false. Rationale: while MI can lead to heart failure, not all cases result in permanent heart failure. Outcomes depend on infarct size and treatment, per AHA complications data. 12. The left anterior descending, LAD, artery occlusion often causes anterior wall MI. True or false? Answer: true. Rationale: the LAD supplies the anterior wall of the left ventricle. Its occlusion commonly causes anterior wall MI, seen on ECG as ST elevation in leads V1, V4, per coronary anatomy. 13. Beta blockers are given early in MI to reduce myocardial oxygen demand. True or false? Answer: true. Rationale: beta blockers, e.g., metoprolol, reduce heart rate and contractility, decreasing myocardial oxygen demand and infarct size, per AHA pharmacologic guidelines. 14. Diaphoresis is a common symptom of myocardial infarction. True or false? Answer: true. Rationale: diaphoresis, sweating, is a frequent MI symptom due to sympathetic nervous system activation during ischemia, per AHA clinical manifestations. 15. Percutaneous coronary intervention, PCI, is the preferred treatment for STEMI within 90 minutes of hospital arrival. True or false? Answer: true. Rationale: PCI is the gold standard for STEMI, aiming to restore coronary blood flow within 90 minutes of first medical contact, per AHA/ACC reperfusion guidelines. 16. CKMB is more specific than troponin for diagnosing MI. True or false? Answer: false. Rationale: troponin is more specific and sensitive than CKMB for MI diagnosis, as CKMB can elevate in non-cardiac conditions, per ACC biomarker standards. 17. The nurse should monitor for ventricular arrhythmias post-MI. True or false? Answer: true. Rationale: ventricular arrhythmias, e.g., ventricular tachycardia, are common post-MI complications due to myocardial irritability, requiring continuous ECG monitoring, per AHA guidelines. 18. Hypertension is a non-modifiable risk factor for MI. True or false? Answer: false. Rationale: hypertension is a modifiable risk factor for MI, manageable through lifestyle changes and medications, per AHA risk factor guidelines. 19. Morphine is used to relieve chest pain in MI patients. True or false? Answer: true. Rationale: morphine reduces chest pain and anxiety in MI, decreasing sympathetic stimulation and myocardial oxygen demand, per AHA emergency protocols, MONA. 20. Elderly patients with MI always present with chest pain. True or false? Answer: false. Rationale: elderly patients may present with atypical MI symptoms like confusion, fatigue, or dyspnea, rather than chest pain, per AHA geriatric considerations. 21. The nurse should teach MI patients to avoid heavy lifting during recovery. True or false? Answer: true. Rationale: heavy lifting increases myocardial oxygen demand, risking further ischemia during MI recovery. Activity restrictions are key, per AHA rehabilitation guidelines. 22. A Q wave on an ECG indicates a previous myocardial infarction. True or false? Answer: true. Rationale: pathologic Q waves on an ECG suggest prior myocardial necrosis from an MI, typically seen in leads corresponding to the infarcted area, per AHA ECG criteria. 23. Thrombolytic therapy is the first-line treatment for all MI patients. True or false? Answer: false. Rationale: thrombolytics are used for STEMI when PCI is unavailable within 120 minutes. PCI is preferred, and thrombolytics are not used for STEMI, per AHA guidelines. 24. Diabetes mellitus increases the risk of myocardial infarction. True or false? Answer: true. Rationale: diabetes accelerates atherosclerosis and impairs coronary blood flow, increasing MI risk, per AHA risk factor data. 25. The nurse should assess for jugular vein distension in MI patients. True or false? Answer: true. Rationale: jugular vein distension may indicate right ventricular failure or cardiogenic shock post-MI, requiring assessment, per AHA clinical evaluation guidelines. 26. MI can lead to cardiogenic shock as a complication. True or false? Answer: true. Rationale: cardiogenic shock, caused by extensive myocardial damage reducing cardiac output, is a life-threatening MI complication, per AHA complications data. 27. Statins are prescribed post-MI to lower LDL cholesterol. True or false? Answer: true. Rationale: statins, e.g., atorvastatin, reduce LDL cholesterol, stabilize plaques, and prevent recurrent MI, a standard post-MI therapy, per AHA guidelines. 28. All MI patients require immediate coronary artery bypass grafting, CABG. True or false? Answer: false. Rationale: CABG is reserved for MI patients with specific indications, e.g., multivessel disease, failed PCI. Not all cases, per AHA surgical guidelines. 29. The nurse should administer heparin to prevent thrombus formation in MI. True or false? Answer: true. Rationale: heparin, or enoxaparin, is used in MI to prevent further thrombus formation and embolization, per AHA anticoagulant therapy guidelines. 30. Nausea and vomiting are atypical symptoms of MI in women. True or false? Answer: true. Rationale: Nausea and vomiting are common atypical MI symptoms in women, often mistaken for gastrointestinal issues, per AHA gender-specific guidelines. 31. The right coronary artery supplies the left ventricle. True or false? Answer. False rationale. The right coronary artery primarily supplies the right ventricle and inferior left ventricle. The left ventricle is mainly supplied by the LAD and circumflex arteries, per coronary anatomy. 32. The nurse should monitor for bradycardia after beta blocker administration in MI. True or false? Answer. True rationale. Beta blockers can cause bradycardia by slowing heart rate, requiring monitoring post-MI, per AHA pharmacologic monitoring guidelines. 33. A history of MI increases the risk of sudden cardiac death. True or false? Answer. True rationale. Prior MI scars the myocardium, increasing the risk of ventricular arrhythmias and sudden cardiac death, per AHA long-term outcomes. 34. MI pain is always relieved by rest. True or false? Answer. False rationale. MI pain, unlike angina, is not typically relieved by rest, as it results from irreversible ischemia, per AHA clinical manifestations. 35. The nurse should teach MI patients to take nitroglycerin for chest pain every 5 minutes up to 3 doses. True or false? Answer. True rationale. Patients with suspected MI should take sublingual nitroglycerin, 0.4 milligrams, every 5 minutes for up to 3 doses if chest pain persists, calling 911 if no relief, per AHA patient education. 36. Elevated LDL cholesterol is a risk factor for MI. True or false? Answer. True rationale. Elevated LDL cholesterol promotes atherosclerosis, narrowing coronary arteries and increasing MI risk, per AHA risk factor guidelines. 37. The nurse should position MI patients flat to improve cardiac output. True or false? Answer. False rationale. MI patients should be positioned semi-Fowlers, 30 to 45 degrees, to reduce preload and myocardial oxygen demand, per AHA nursing care guidelines. 38. An inferior wall MI is often caused by right coronary artery occlusion. True or false? Answer. True rationale. The right coronary artery supplies the inferior wall. Its occlusion causes inferior wall MI, seen as ST elevation in leads 2, 3, AVF, per AHA ECG criteria. 39. Clopidogrel is used to prevent platelet aggregation post-MI. True or false? Answer. True rationale. Clopidogrel, a P2Y12 inhibitor, prevents platelet aggregation and recurrent thrombosis post-MI, often used with aspirin, per AHA antiplatelet therapy. 40. MI can cause left ventricular aneurysm as a complication. True or false? Answer. True rationale. Left ventricular aneurysm, a weakened myocardial wall, can form post-MI, increasing risks of heart failure and thromboembolism, per AHA complications.